Difference between case control and cohort study. Case control studies are the retrospective studies. That's why it proceeds from effect to cause. Cohort study, it is prospective studies. That's why it starts from risk factor to effect, that is disease. Case control study, it starts with disease. Cohort study, it starts with risk factor. Case control study tests whether the suspected cause occurs more frequently in those with the disease than among those without the disease. That means here if the person has smoking, that develop cancer or not. In cohort study, test whether disease occurs more frequently in exposed than in those not similarly exposed. In cohort study, what we are studying is we are assessing the smoking groups only develops cancer or other. Then next one, usually the first approach to the testing of a hypothesis, but also useful for exploratory studies. So in case control studies, we are using for the testing of our hypothesis, but also it is help in exploratory studies. Cohort studies, it is used for pre-sized or pre-formulated studies or pre-formulated hypothesis. Case control studies, it involves a fewer number of subjects or small number of subjects. Cohort studies, it includes large number of subjects. Case control studies yields relatively quick results. But cohort study, it needs a long follow-up period. Case control studies, it is suitable for rare disease. Cohort studies, it is inappropriate for rare studies. Case control study, it generally yields only estimate of relative risk or the odd ratio, but cohort studies, it yields in incidence rate, especially the relative risk and as well as attributable risk will be get. In case control studies, it cannot yield information about disease other than the selected studies. But cohort study, it gives more than one disease they are getting information. So smoking habits may cause lung cancer, or smoking may cause the bladder cancer, so like that, or smoking may cause COPD. So different disease can be identified by one risk factors in cohort study. Then in case control studies, it is relatively inexpensive, but cohort studies are expensive.